how do we do engagement better? How do we engage within the Indigenous community and within all of Canada with the Indigenous community?
Yeah, thank you for that. I would first like to acknowledge and thank CADTH for inviting me to participate on the panel today and yesterday, because I think for people who haven't done a lot of work in Indigenous health or done a lot of engagement with Indigenous communities, this is a really safe and accessible first step to bring it into an arena for your consideration and to begin thinking about it for people who haven't. So the first step of that, answering that question for me, is to really talk about what reconciliation is, and in a 2-minute version, not the. You could all, of course, go to the TRC website and read the reports. So in December of 2016, Senator Murray Sinclair made a Facebook post that really captured my attention. And I've been doing some reconciliation planning both for the Winnipeg Regional Health Authority and for the Rady Faculty of Health Sciences at the University of Manitoba. So I've had a lot of time to think about it. But his post basically said, reconciliation will never be achieved as long as one side believes it's the recognition of rights and the other side believes it's an act of benevolence. And I would say I see those two sides represented very often without people understanding their position or why they're on different pages. So in a rights-based framework, we would be considering Indigenous rights like the United Nations Declaration on the Rights of Indigenous Peoples, which the TRC calls the framework for reconciliation, and which Canada has committed to fully adopting and implementing. And within that includes the individual and collective right of Indigenous peoples to be self-determining, to have free, prior, and informed consent, to participate in decision-making about matters that impact them, and to participate in development of health programs and to run health programs through their own institutions as much as is possible and is desirable. So those are some key highlights of what a rights-based approach would entail. On the other side, the benevolent approach, if we look at the definition of benevolence, is kind of kindly and well-intentioned. This I would consider the people who maybe want to dabble a bit, who want to feel good about doing something in Indigenous health, but without a structural, resourced, organizational commitment to actually have that meaningful engagement. And so in a benevolent approach to engagement with Indigenous communities often would be what I would sometimes refer to as the checkbox approach. Check, we've done it. The topics are dictated by the more powerful or often more resourced organization. The location of engagement is dictated by the organization. The mechanisms for how the process goes is dictated by the organization. And quite often, there's no accountability loop or ongoing relationship after, a single type engagement event. I would highly caution against that. A rights-based approach to reconciliation and engagement would be much more about a long-term relationship. And you might hear communities or Indigenous organizations talk about a nation-to-nation relationship. So that respect for the self-determination of that community or collective, which could be defined as the power of that community to both define its dreams and have the resources and ability to achieve those dreams with the partners that they would choose. A rights-based approach to engagement and to reconciliation would certainly be looking at having the right people around the table. So I'll give you one example. In Manitoba, there is a provincial cardiac care network, and they, with good intentions, wanted to include some Indigenous representation on that cardiac care network. Everybody on that network is either like a hospital administrator or a clinician. And for Indigenous engagement, they wanted to put an elder on the community, or on the committee. Now, on the one hand, you say, okay, that's great, you want to include that. On the other hand, in a room full of 20 clinicians and administrators, what is a lay person of any background, how comfortable are they going to be able to speak at all, much less to speak to really complex clinical issues? So when that question came to me as the medical lead for Indigenous health programs, I said, well, I happen to be an Indigenous person with a large background in Indigenous health, and I practice cardiology. So let's just say thank you for the invitation, but instead of the elder, I'll join your committee, right? So it's defining who the right stakeholder and appropriate representation is. Certainly, it's around negotiating and agreeing on what the priorities for the engagement is. There can be a lot of mismatch in where organizations are at compared to where communities are at. So finding the shared priorities. To negotiate the processes and the locations is really important, and those can change over time. One really important part of engagement with Indigenous communities is that all knowledge is put on the table. So we do want you to bring your best Western scientific evidence-based knowledge, guidelines, et cetera. We also want to equally value the community's knowledge, whether that's traditional knowledge or experience of the context or past negative experiences. All that knowledge gets put on the table. And then ultimately it is the Indigenous communities that have the power to decide which knowledge is most valid and relevant for them in their decision-making around matters affecting them. The relationship has to be ongoing, and there needs to be accountability. So if we commit to something, then we follow through, and of course at our next contact, we're talking about how it went and planning our next steps together. So it does certainly take a lot more time, and there has to be much more check-ins about how it's going. Now, in terms of the meaningfulness of it, I would parallel it kind of to the notion of cultural safety, which some of you may be familiar with. Cultural safety is a term described initially by some of our Maori colleagues, a Maori nurse from Aotearoa, New Zealand, and really has to do with healthcare providers understanding their positions of power and privilege in society, and also how that translates and is reflected in the healthcare relationship, and actively seeking through self-reflection to neutralize that power imbalance in the provider-patient relationship, such that the Indigenous person's cultural identity is strengthened and maintained and is certainly not demeaned or disempowered. And really importantly, an interaction is defined as culturally safe by the individual, not by the provider. I can't go in and say, okay, I just did an excellent job, that was a very culturally safe interaction. No, it's the individual who gets to decide if it was a culturally safe interaction for them. In the same way, it is the Indigenous community or partner that you're engaging with that gets to define if it was meaningful engagement or not. You don't get to say that you consulted them if they feel like their voices weren't heard, that the decisions were already made and it was a photo op more than anything else. So just to keep in mind that meaningful is defined by the other party.
Thank you very much.